Tracy, we're talking about paid family medical leave. There is a federal Family Medical Leave Act that gives people time off. Why isn't that enough?
Well, the Federal Family and Medical Leave Act that was established in 1993 really is insufficient to support the needs of New Mexico working families. So it provides up to 12 weeks of unpaid leave to people who work for an employer that has 50 or more employees, who has been employed for at least 12 months and has worked for at least 1,250 hours during that 12-month period. For New Mexico, we're a small business state, and only 4% of employers are even required to provide unpaid leave through the FMLA. So this is really an opportunity for us to be able to step in and provide supports that just are not being provided federally for our workers.
We've seen proposals like this here at the Roundhouse for a few years in a row failing. The current version of this has changed a lot. Can you kind of recap for us how this has changed just this session and why?
Yes, so the House sponsors, we are really grateful to them for continuing to work on this, even in the face of the defeats that they've had in previous years. They worked really hard with some of their colleagues to find a solution to get this passed through the House. However, we do have some concerns. Our coalition, we have over 100 organizations and businesses that have come together to work on this. And some of our coalition partners advocate for the rights of people that have severe chronic illnesses like cancers and blood cancers. And we know that 6 weeks just isn't enough time for people to really be able to get the treatment that they need and return to work. That's one concern. Another concern is really around the welcome child benefit and whether the structure of that makes sense for New Mexico families. We really want this to be to work well for all families in New Mexico, and so that's a concern we have, and we've been asking some questions and working toward understanding more about how this is structured.
One of the biggest arguments against this that we've heard from business owners across the state is the worker shortage that it would create. As you just said, New Mexico is a small business state. A lot of these companies don't have very many employees, and if one goes on leave, then they have to find someone else, but there is a shortage of skilled workers. So, how are business owners expected to cope with having employees on leave and trying to find somebody else?
That's a great question, and one that I'm really excited to answer, because I think that this is really a misunderstanding in the bigger picture of passing a Paid Family and Medical Leave Act. So what we know from places that already have established paid family and medical leave programs is that people who are currently on the sidelines, who have caregiving responsibilities or who are dealing with chronic illnesses that have to take time away to travel for appointments, particularly in rural communities, are on the sidelines right now of our workforce. They are not participating in the workforce, and if we want to increase our workforce participation rates, we really need access to this kind of safety net to encourage folks who otherwise wouldn't feel like they could participate to participate. And we've actually seen some research come out that says that if New Mexico implemented a Paid Family and Medical Leave Act, we would have 47,000 additional workers available for work in New Mexico. And so, we really believe that that's one component. And the other component is that when people have the opportunity to take time off for managing a health condition or welcoming a new child, they are much more likely to return to work when they're fully ready to work, be more productive, have higher morale, and we know statistically that they're more likely to be employed with that employer 2 years after the event that caused them to need to take leave. And so we really see this as being about recruitment and retention of high quality employees.
Tracy, thank you so much.
Thank you so much for your time.